Hello everyone. In this practical class, we'll try to learn how to determine the blood group. There are more than 200 antigens, blood group antigens, and more than 30 blood groups have been identified till now. These blood groups have been divided into two major categories, major blood groups and minor blood groups. Major blood groups are ABO and RH, and minor blood groups are many like MN system, Lutheran, Duffy, Kell, and many other. The major blood groups, they will have a strong antigen antibody reaction, and hence they are going to lead to fatal consequences, whereas minor blood groups, they will not have such an effect. In this particular class, we'll try to determine the blood groups of ABO system and RH system. The principle here is commercially available known antiserums containing antibodies are mixed with red cell suspension of an individual, and presence or absence of agglutination is observed. Agglutination with an antiserum that containing antibodies indicates presence of agglutinogen on RBC surface corresponding to that antiserum and hence the blood group. So blood group system, it is based on the Lance-Stenius law. Lance-Stenius law says that if an agglutinogen, that is antigen, is present on RBCs, the corresponding agglutinin, that is antibody, must be absent in the plasma. The second law states that if an agglutinogen or antigen is absent on the RBCs, the corresponding agglutinin or antibody must be present in the plasma. The first law is applicable to all the blood groups, that is both ABO and RH blood group system. But the second part is not necessarily always true for RH blood groups. So here the antigens and antibodies of ABO blood group system. Okay, so if you see in a blood group A, so they have antigen A and antibodies against B, whereas in blood group B they have antigens B on their RBC membrane, they have antibodies against antigen A in the serum, whereas in blood group B, so they possess both the antigen A and B and they do not have any antibodies, whereas blood group O, or the RBC membranes, there are no antigens but they possess both the antibodies for antigen A and antigen B, that is anti-A and anti-B. For determination of the blood group, the apparatus and reagents required are antisera A, antisera B, antisera D, normal saline, pipettes, porcelain tiles, and with a depression, microscope to confirm agglutination if there is any doubt. Procedure is a red cell suspension in 0.9% and sodium chloride is prepared in a porcelain tile, that is 1 drop of blood plus 2 to 3 ml of normal saline is added. Using separate pipettes, take 1 drop of antisera A, 1 drop of antisera B, and anti-D is taken into different cavities of porcelain tile or in a slide. To each of these cavities, add a drop of red cell suspension and mix it well. Observe the agglutination or clumping. The absence of agglutination is confirmed by microscope. Determination of blood group from the following table. If there is agglutination with antisera A and there is no agglutination with anti-B and there is agglutination with anti-D, so then that blood group is called as A positive. If there is no agglutination with antisera A but there is a agglutination with anti-B and anti-D, so then it is called as B positive. If agglutination occurs in all the three antisera, so then that blood group is AB positive. If agglutination occurs with none of the antisera, then that blood group is O negative. Okay, so this is how blood group is determined based on the agglutination. So again, in a blood group A, you have antigen A and antibody B. With the blood group B, you have antigen B, antibody against A. Then in the AB blood group, you have both the antigens but no antibodies. But in O blood group system, you do not have any antigens, but you have both the antibodies. So then it has to be reported in the following format. That is, my blood group is A positive or A negative, depending on the agglutination. So normally during blood transfusion, the O blood group can receive the blood from all other blood groups. Like he can receive blood from A, B, AB or O. Whereas AB blood group is called as universal recipient, that he can receive blood group from O, AB, B or A. Okay, so that is why blood group O is called as universal donor and AB is called as universal recipient. Okay, so as we know that the Rh antigens are also comes under the major blood group system, and they can lead to strong antigen antibody reaction. The Rh antigens, they are not naturally occurring they do not possess naturally occurring antibodies. When the first time Rh antigen they are introduced into the body, subsequently they are going to produce antibodies. And when second time Rh positive antigen is introduced, so there can be Rh incompatibility. Okay, so similar Rh incompatibility occurs during pregnancy if a mother is Rh negative and the born child is Rh positive. Okay, so if the first born baby is Rh positive, during pregnancy nothing will happen to the baby because there are no antibodies formed still. But during the parturition, some of the blood group mixes with the maternal blood, and in the maternal, when the blood enters into the maternal circulation, they are going to develop the antibodies against these Rh antigens. During second pregnancy, if again the Rh positive baby is born, so then there are chances that these antibodies they can cross the placenta because they are IgG type and readily crosses the placental barrier. They can act on the RBC's membrane to cause antigen antibody reaction, and there it leads to hemolysis, and it will be responsible for the hemolytic newborn disease. That is, the born baby will be having Rh incompatibility with anemia and jaundice. So when during blood transfusion, if when the blood group is matched, but still the cross matching is done to look for any presence of minor blood group system. Okay, so for which the major cross matching and minor cross matching are done. Okay, so in major cross matching, donors RBCs are matched with patient's serum, whereas in minor cross matching, patients RBCs are matched with donor's serum. Okay, so this can prevent some of the antibody reaction that could occur because of the minor blood group systems. So this is another example of cross matching. Okay. In major cross matching, the donor's RBCs are matched with recipient's serum, whereas in minor cross matching, the recipient's RBCs are matched with donor's serum. So when transfusion reaction occurs, I mean, if the incompatible blood is transfused, so there can be antigen-antibody reaction. It will lead to hemolysis, anemia, and jaundice. Okay, so initially there can be shivering and fever, that is febrile reactions, which is very commonly seen because of the liberation of the toxic substances because of the hemolysis. So there can be a hemoglobinuria. The released hemoglobin can be lost through the kidneys. It can lead to hemoglobinemia. So then obviously there can be hemolytic jaundice and there can be acute renal failure. Acute renal failure mainly occurs because of the hemoglobin cast blocking the renal tubules and damaging the tubules. Or it can be because of the release of toxic substances from the lyse red cells that cause renal vasoconstriction, and eventually it is going to lead to circulatory shock. Hyperkalemia is usually occurs because of the release of potassium ions from red cells. So this may cause cardiac arrest in diastole. So there can be some adverse reaction occurs because of the faulty techniques while giving the blood. Due to wrong method of transfusion, the following complications may arise. So first one is thrombophlebitis. This is a common complication in those who receive repeated transfusion. And there can be air embolism. Air enters the venous circulation and gets lodged at the outlet of the right ventricle and blocks the flow of the blood to the lungs. Death may occur in severe cases. The use of plastic bags has reduced this complication. So this is regarding how the blood group is determined and some of the complications of RH incompatibility or ABO incompatibility. Thank you.